As we saw from a previous report, many countries are concerned about a sudden inflow of travelers from China as the country loosens its policies against COVID-19. South Korea, too, is expected to announce new measures on those coming in from its much bigger neighbor. So how concerned should South Korea be? We have Dr. Kim Seung-taek, head and professor at Zoonotic Virus Laboratory, Institut Pasteur, Korea. Good morning, Professor.
Good morning.
Now, what's a realistic way of preventing a large outbreak that could be caused by an inflow of people coming from China, you would say?
Well, I would say without actually a strict border closure, this virus is a respiratory virus, which means this virus can transmit it very easily. So not just only in China, but anywhere in the world. I mean, without just open the borders, the virus will just circulate and then arrive in our country. And I think just maybe like in US, maybe just a COVID-19 test pre-screening would be a way to just mitigate the transmission. And I also want to just indicate that where there are many just cases of COVID-19, there are more chances of emerging just new variants, including, well, for example, Alpha variant from UK and the Delta variant from India. So I think our government should just monitor what kind of just variants are actually emerging from the mainland China.
Right. Now, speaking about our own situation here in South Korea, the death toll has been concerning for the government recently, with the weekly average number of deaths at 56 at the moment. That's up 20% from last week. Why is this the case when there are treatments now available for COVID-19?
Well, there is some sort of trend in terms of death tolls. I mean, this is actually just observed in mostly in the U.S. And I think the situation is very similar in Korea. The first the case was before just no vaccine was just available. Then that time actually most of the death was actually observed among the intrinsically very weak people, which is actually include elderly people and then some people with some underlying medical conditions. And then the trend actually shifted after vaccination just started. So that time is since the vaccination started, most of the deaths were actually observed among the people who were not vaccinated. But now the situation has actually just a little bit changed. Now many people are actually just somehow got the immunity, whether it is by some vaccination or natural infection. So most of the deaths now we are observing it's mostly just a matter of just diagnosis and the treatment. We have very effective antiviral drugs, which include the Paxlovid and then the remdesivir and then the molnupiravir. But then the very important thing is because of the mechanism of this drug has to be just administered as soon as possible. So, for example, like the Paxlovid is 3 days or just 5 days within the symptom onset, or like 7 days in the case of the remdesivir, the symptom onset. So the sooner, actually, the better in the case of this antiviral drug. Although if we actually lose the certain window of this treatment, we have another drug we can use. So for example, like just some steroid drugs. But in terms of efficacy and also preventing progression to just a severe disease and death, it's very important to just diagnose very fast and then start the treatment very early. If we lose the certain window, we cannot use this just a drug. And even if we use this drug, we cannot expect any very good efficacy.
Right. And now, speaking about the current situation here in South Korea, the government last week decided not to remove the indoor masking for the time being. How do you rate the decision by the government and to postpone, basically, removing the indoor mask mandate at this point of the pandemic?
Right. Well, actually, some people expected maybe just removing the indoor mask mandate last week, but then it was not actually, it did not happen. And I think the government was trying to be very cautious because now we are experiencing the seventh wave of COVID-19, and though we are also in the season of just a year end, at the end of the year, which means that there are just some year end, Christmas Day holidays, and also we are expecting some New Year's Day, which means that many people just get together to celebrate and then maybe just to enjoy themselves. And now all these settings actually occur. Now this is winter season. occur in the indoor settings, which means that the virus can be transmitted very easily. So this, in considering just all those factors, I think just the government somehow just postpone at least until the just New Year's Day, just holidays. And even if this government actually removed the indoor mask mandate, I think there might be some exception, which would include maybe some hospitals and then the nursing homes and hospital and some public transportation. Those are very just the places we have some very high risk for very easy transmission to the very just vulnerable people.
Right. Well, thank you so much for your insights. As always, I hope you have a great day and Happy New Year, Professor.
Thank you. You too.